A very good afternoon, everyone. My name is Fahad Shahid. We welcome you to another live session of Prime Health. Another important session on COVID-19 and heart damage. A very, very important session today. As we all know, in the previous year, we have been through a very worst pandemic, and definitely this COVID-19 not only affected our health, but also it has affected the other organs of the body. And what we are going to talk about is specifically on heart. I have with me a very special guest here today, Dr. Jacob Chaku. Doctor, thank you very much for joining us. Dr. Jacob is a specialist cardiologist practicing in Prime Medical Center at Jumeirah. And Dr. Jacob has an extensive experience of 30 years, out of which for the last 20 years he's been practicing in UAE. Doctor, thank you very much once again for joining us. Doctor, we all know that COVID-19 has affected the whole world, and obviously there are some other possibilities, and of course some other, I should say, damages that COVID-19 has done. When you talk about specifically on heart, we get a huge lot of topic to discuss on chronic patients with heart diseases and of course COVID-19. So we are going to take advice of doctor. Doctor is going to talk about a very important session today. Let me tell you that once doctor finishes the session initially on the talk, then you're more than welcome to ask your questions and we will answer. Dr. Jacob, once again, thank you very much, and I will not take much of the time. Please, thank you.
Everybody is so familiar with COVID-19 and it doesn't need any particular introduction, but I think the topic of COVID-19 affecting the heart is probably a little new because many people are not aware of what it can do to the heart. We knew from the very beginning that patients with underlying conditions are at a higher risk for complications from COVID-19 infections. In fact, 50% of the hospitalized cases have been with chronic medical illnesses. And it was also found that the severest forms were twice more common in people with cardiovascular diseases. And also, the highest mortality was seen among patients with pre-existing cardiovascular diseases. So everybody knew that having a pre-existing condition related to the heart was not good for COVID infection. If you look at the split up of certain statistics, we come to know that 40% of COVID-19 patients had cardiovascular or cerebrovascular disease. So it was not uncommon or rare thing. It's very common to have COVID in cardiovascular disease patients. And out of which about 17% developed some kind of irregular heart rhythm or arrhythmia. And 7% developed acute cardiac injury. That means damage to the heart muscle. About 9% went into shock. That means very low blood pressure, which led to complications and also other problems, and including death. And about 4% had acute kidney injury. Myocarditis, which is a direct inflammation of the heart muscle, was also found in this group of people. And not only were the severe forms more common in cardiovascular patients, but they were also found that the fatality rates, that means patients who died from COVID-19 had higher than normal average percentage, from the general population. And if you compare, for example, with cancer, about 5.6% of patients who died had cancer, whereas cardiovascular diseases were found in 10% of the people who died. So cardiovascular disease definitely is a predisposing condition for serious illnesses and mortality resulting from that. And I'll just tell you a couple of other conditions which can cause severe illness other than cardiovascular or heart conditions: cancer, chronic kidney disease, chronic lung diseases, and even obesity. Any BMI, body mass index, more than 30% predispose patients with to more severe illness if you contact COVID-19 infection. Pregnancy, smoking, type 2 diabetes are other conditions which may also predispose one to more severe illness, complications, hospitalizations, and even death. But this is something which we knew from the very beginning, but of more concern are the recent findings. I'll just mention two studies which have come up of late, both from the Journal of American Medical Association, which found that one-fourth of those hospitalized with COVID-19 have been diagnosed with cardiovascular complications. And it contributes to about 40% of all COVID-related deaths. And the first study in JAMA, or the Journal of the American Medical Association Cardiology, it studied on 39 patients who died of COVID-19 infection, and they found that there was presence of infections in the hearts. These people did not have previous cardiovascular issues when they were ill. So even so-called patients who had no cardiovascular diseases had evidence of cardiovascular infections when their autopsies were done. Probably they died of complications. We do not know the details. The second study was done with on patients who were discharged after hospitalization. These were done with cardiac MRI, and 100 patients were who recovered from COVID-19 infections in the preceding 2 to 3 months were studied. And of particular importance is to note that most patients in this group were not hospitalized. But they found that abnormalities in the heart in almost 80% of these people who had COVID-19 infection in the preceding 2 to 3 months, who were not hospitalized, and probably who didn't even have symptoms, anything related to the heart. But they had evidence of abnormalities in the heart when a cardiac MRI was done. And they also found that 60% of this group had ongoing myocardial inflammation in the form of high troponin level, which indicates muscle damage. And also, but when their heart function was preserved, it was not that bad that they should go into heart failure. But this again raises the questions like what happens to these people when later on? We have no specific answers at the time being. Most of these people recover by themselves, they become limited in their symptoms, or they may have no symptoms at all. But some of them may develop complications where it may be manifested like palpitations, that means fast heartbeats, or irregular heartbeats, or they can also have heart failure leading to shortness of breath and tiredness, very exhaustion, like they can't do things as before. And they also are more prone for cardiovascular events because COVID-19 can also affect the clotting, the blood system, clotting system. Basically, the heart is involved by two mechanisms. One is the direct involvement of the lining of the blood vessels called the endothelium, which leads to increased thrombosis or clotting of the blood on the surface of the blood vessels. And this can, when complicated, when in association with already existing heart condition or hypertension or diabetes, can lead to increased thrombosis, leading to even heart attacks. And second thing is by directly decreasing the oxygen supply to the muscles, like if, for example, if the lungs are involved, it can cause pulmonary embolism or thrombosis of the pulmonary arteries. They can have pneumonia, and all this can lead to lower level of oxygen levels, which can again damage the heart muscle by decreasing the oxygen supply to the heart muscle. So, in different ways, the heart can be affected, but of particular importance is to note for excessive tiredness or exhaustion after a COVID-19 infection, even though you were not hospitalized or you didn't have symptoms of cardiovascular significance when you were ill, and shortness of breath, palpitations, which can be a manifestation of arrhythmia or irregular heartbeats. And of personal note, I had 3 patients who had come with some form of symptoms after COVID infection. None of them were hospitalized. None of them would be categorized as having severe illness. All were young. One lady had a pericarditis, that means collection of fluid around the heart. The second one had a direct involvement of the muscle, which is called myocarditis. And this young man was playing cricket and he found that he couldn't play as before. That's why he came for a checkup. And the third person had very irregular heartbeats. So all these forms are prevalent, and unless you are watchful, you may miss the symptoms in the early stages. But if you are careful, you may pick up these symptoms and can come to a cardiologist, and the necessary investigations, and if needed, treatment can be given. But the silver lining is most of the patients, even if they have symptoms or some form of abnormalities, they may subside by itself. As of now, there is no current guideline to tell any patient to do anything related to the heart after a COVID infection unless they are symptomatic. And the treatment wise, also, probably it will be all symptomatic related to the symptoms and the cause for the symptoms. There's no specific treatment because we don't have any antiviral medicines or any of that sort so far.
Great, thank you, thank you so very much, Doctor. That was wonderful explanation in the beginning, actually. Doctor, before the session, we had some questions that came in, and I really wanted to ask a few of them. Some people have registered us with the session. Dr. Faiza Zulfikar asks, she has asked, can people who are vaccinated in COVID-19 can also get any cardiac symptoms like palpitation?
I have seen quite a few patients who went for vaccination, and before the vaccination, their blood pressure went up. But that has nothing to do with the vaccine except the stress or anxiety related to the vaccination. But I have not come across anybody complaining of palpitation, or nor have I heard of anybody developing any cardiac arrhythmia except for allergy related complications.
Great, thank you. Dr. Mohammed Maqsood has asked a question. What should we do for post-COVID palpitation and how it should be treated?
Post-COVID palpitations, one of the common the reasons may be a myocarditis which was not picked up, and the muscle can be directly involved in COVID, and an echocardiography will give you the diagnosis straight away. And also, you can do a troponin test because sometimes it may not be an outright myocarditis, but it may be cardiac muscle injury, which will show that the troponin level is high. So both these groups are prone for irregular heartbeats, arrhythmias. So, if doubtful, you can even do a Holter monitoring for 24 hours to pick up irregular heartbeats and then treat it accordingly. And in severe forms, of course, heart failure can be a cause for palpitations or increased heart rate and also shortness of breath. And that can also be picked up by doing an echocardiogram.
Great, thank you very much, Doctor. Doctor, I've got a question here from Ms. Sainarain. And the question says, if vaccinated and the person still gets COVID with mild symptoms, does it protect the heart better?
One of the advantages of being vaccinated, as far as I know, is to prevent severe illness. They may have simple, mild symptoms, but as I said, mentioned in the two studies in JAMA, the studies were done in asymptomatic patients. So they are the ones who recovered from COVID-19. I do not know whether vaccination gives them an advantage over non-vaccinated patients, but they are the ones who showed that 80% of them had some form of heart involvement. So if you apply the general principle that 80% are affected in the heart in some way, then these people also can be affected. But I have not come across any studies showing more prevalence in such patients.
Great, thank you. Doctor, I've got another question here. In fact, two different questions, but I believe they're more or less related to each other. The first part of the question is from Ms. Rafia, and she says, is raise in blood pressure also a reason for post-COVID? And following to that question, Dr. Deepakman has asked a question, how many days we need to take medication if the blood pressure is still risen post-COVID?
COVID as such does not increase your blood pressure except if you are anxious. Like I said, I have come across quite a few patients who went for vaccination and the blood pressure was high, but just one tablet of beta blocker should be enough. But some people, this may be a precipitating factor and the blood pressure may be sustained. In such cases, you may have to do an ambulatory BP monitoring for 24 hours and decide whether they need long-term medication or not. But COVID by itself does not cause high blood pressure. If you have high blood pressure, you may be more prone for severe illness. It's the other way around. COVID by itself, I have not come across anybody having high blood pressure.
Thank you, Doctor. A question came from Mr. Anas saying, if COVID causes heart damage, is it reflected during the infection or only post resolution?
From the talk, it may be clear to you that both can happen during an acute infection, COVID infection. The heart muscle can be directly involved, or the endothelial, the lining of the blood vessels can be involved, leading to more thrombosis and heart attacks, and instant thrombosis, all kinds of complications. But as the two studies in JAMA shows, almost 80% of even asymptomatic patients are affected in their heart by COVID, even though they may not know it. So, any development of any new symptom of palpitation or heart failure or tiredness, excessive tiredness, need to be probed and investigated properly.
Thank you, Doctor. Kasparian has asked a question. What kind of tests should I get after recovering COVID-19? Why we still not feel 100% even after 1 month? It's more of a question related to COVID.
COVID is basically a multi-system disease. It can affect the lungs, it can affect the blood, it can affect the heart, kidneys. Any part of your body can be affected by COVID. So recovery depends on what complications you had or which part of your system was more involved. So any of one of these complications can lead to tiredness, and some people take more time than others. Some recover very fast. And there's no particular test that is recommended after COVID to be done unless you are picked up with some form of complication during your illness. Like I said, for the heart, troponin is one test, but this is not routinely recommended for everyone. And if you have symptoms related to the heart, then relevant tests like an echocardiography or ambulatory BP monitoring or Holter monitoring should be done.
Thank you. Doctor, how COVID-19 has affected the chronic patients and what kind of damage it has given to them?
Chronic conditions do not predispose anyone to COVID infection. They are as vulnerable as the general population, but then COVID infection, chronic conditions predispose them to have severe form of the illness if they contract COVID-19 infection. So the stress should be on prevention. And like I said in the beginning, almost 40% of cardiovascular disease patients had severe illness or had higher mortality. So the idea is to get all the existing conditions as much under control as possible, like blood pressure or cholesterol or sugar, like in diabetes, and then lead a healthy lifestyle by, one of the most important things is to exercise, increase your immunity and also lose weight, because obesity itself is a condition leading to more severe illness. And if you are a smoker, the best time to quit it.
Absolutely. Thank you, Doctor. I've got a question here from Mr. Korat. I had COVID-19 positive last year, March. Company requested to take COVID-19 vaccination. I'm a heart patient and continuing medicine since last 16 years. Will it be any side effect for or any diseases if I take vaccination?
Vaccination by itself doesn't cause any heart or any other side effects as far as we know. It applies to the general population, whatever complications the vaccine may have. It applies to the general population and patients with heart disease the same way. But the only thing is, if you already had COVID infection and you recovered from it, so maybe it's better to go for some form of an echocardiography or something to look at your heart muscle. And if everything is fine, then I don't think you should have any hesitation in taking a vaccine.
Thank you very much, Doctor. Uh, Doctor, another question from Ms. Russia, and she's saying, if I was COVID positive and quarantined myself, second, once I became COVID negative, can I be operated for CABG, having triple vessel disease, or is there a waiting period? Very important, please, if you can reply on.
If you had a recent surgery and you develop COVID infection, then you come into the most severe form of category. But then the other way around, there is no contraindication for undergoing surgery just because you had COVID infection, particularly if you have come out of it without any sequelae related to the kidneys or related to the lungs or even the blood. So if you are like any other person without any residual complications or symptoms related to the COVID infection, then I think you can go ahead with the CABG surgery.
Thank you so very much, doctor. I've got a question here. Question says, recommendation of aspirin post-COVID infection. What do you have to say on this?
Aspirin is not routinely recommended for post-COVID infection patients. Of course, aspirin can prevent some of the thrombotic conditions or clotting abnormalities. If you are already a patient of heart, like chronic ischemic heart disease, or on any other or several TIA, transient ischemic attacks or strokes, then you can continue with the aspirin. But for prophylaxis, I have not come across anybody advising it.
Doctor, how smoking affects heart health? Do we see different recovery, outcomes post-COVID in smokers and non-smokers?
Of course, smokers are at least twice more vulnerable for ischemic heart disease and heart attacks. That's in general applicable to everyone. But obesity and smoking makes you more vulnerable for the severe form of COVID infection if you contract COVID-19 infection. So smokers may have more severe illness compared to non-smokers.
Absolutely. Doctor, what are the tests recommended generally to check heart health? Any particular criteria or age? How to proceed ahead?
There are two ways in which you can approach this question. One is to look for what we call risk factors. There are at least 10 known risk factors for ischemic heart disease or things which cause heart attacks, starting with age, sex, cholesterol, sugar, smoking, obesity, lack of exercise, family history. Then there are certain rare conditions. So all these things can be checked whether you have symptoms or not. But then if you're above 40 or that age group, 40 is not a cutoff. I have seen heart attacks even in very young patients. So anybody with any symptom related to the heart, like chest pain or shortness of breath, or any kind of heaviness in the chest, or not being able to work out as before, they should go through at least a treadmill test. That's the simplest thing you can do to make sure that your coronaries are fine and you're getting enough blood when you exercise.
Thank you, doctor. Doctor, as it's 21st of March and it's a Mother's Day in UAE also. Just looking forward to the question, doctor. Has COVID-19 affected female and male separately with respect to heart diseases? Has there been anything that has come out?
I'm not aware of anything in particular between the sexes, but then pregnancy is one of the conditions where COVID infections can be severe. So, as far as possible, pregnant women, mothers, expected mothers should be very careful in being exposed to patients or coming into contact with anyone with COVID. They should be extra cautious.
Right. Doctor, are COVID-19 patients more prone for chronic heart disease?
Chronic heart diseases depends on how much damage this COVID infection has done to particularly the heart muscle, because as I said, most of these mild forms of cardiac injury or myocarditis may resolve by itself without any treatment and nobody may even know about it. But there may be some cases where the myocardial damage can be more severe and that may progress to heart failure if not properly taken care of.
Doctor, a recovered COVID-19 patient, has that patient more, chances of having a future event of any heart attack rather than a person who does not have any COVID-19? Has it affected this way?
The chance of having a heart related problem, particularly of coronary thrombosis, is more in the acute phase, because that's the time when the clotting system is totally abnormal and there is more chance for clotting, and particularly with the endothelial damage, it can lead to acute myocardial infarction or instant thrombosis if you already have a stent inside. But long term, I don't think they are vulnerable for any kind of a heart attack just because they had COVID.
Thank you very much, Doctor. Doctor, as we are moving towards the closing of the session, I wanted to ask you how to prevent the heart if tested COVID positive. This is, I believe, a very important question that most of people want to know.
prevent heart-related problems
Yes.
if you're already COVID positive.
Yes, doctor.
Um, Basically, we don't have any treatment for the heart
Heart
as such.
failure, to avoid heart failure.
Heart failure.
Yeah.
The first thing will be to diagnose as early as possible. So, if you have any symptoms related to the heart, like palpitation or heart, shortness of breath or tiredness, severe form of exhaustion, then a cardiac evaluation should be done. And the most easy thing to do is an echocardiography, which will give you the condition of the heart muscle, and you can make out whether the heart muscle is damaged in any way. And if it is normal, then it's only a matter of following up with maybe more medicines to boost your immunity to prevent another COVID infection or any other thing. And of course, changing your lifestyle for a better heart health condition. But if the heart muscle is involved, then you need follow up at frequent intervals to make sure that the heart muscle doesn't is not more damaged or the heart doesn't get enlarged and lead to heart failure. So here you may need expert opinion and assessment of a cardiologist.
Thank you, Doctor. Moving towards, I'll ask the last question and we move towards the closing of the session. Doctor, as we know that 2021 is the year of vaccination that we are looking forward, is there anything what you can explain on vaccination recommendation for people with high blood pressure? Is it recommended for them to take vaccination or no? Or if no, then why?
There's no contraindication for patients with high blood pressure to be vaccinated. In fact, they come into the chronic high risk category. The only problem is most of the time when you are exposed or these patients are very vulnerable, volatile, many of them emotionally, and stress or any anxiety related stress can cause increase in blood pressure. So the best thing is to watch the blood pressure, monitor it for a few days, and adjust the medication if it's not under control. Particularly so when they go for the vaccination. I have seen many patients being sent back because the blood pressure has shot up to more than even 200. One of my patients had blood pressure up to 220 while waiting for the vaccination. But then, if they are on a beta blocker, if they are not already on, most of them will be under control within 3 hours or 4 hours. And if needed, they can take it for a day or two and then stop.
Thank you very much, Doctor. Just one more question has come up. Mr. Rajesh is asking, at 87, at the age of 87, a person whose heart is pumping at 22%, could there be a chance of improving of the pumping rate?
It depends on what is causing the low heart ejection fraction. 22%, I suppose, is the left ventricular ejection fraction, which denotes very severe form of heart weakness. So, if it is already due to some non-reversible condition like a heart attack or some form of cardiomyopathy, then there is chance, particularly if there is it's due to blockages in the arteries. So in advanced centers, they always do some form of test to make sure that the blood flow to the heart muscle is normal. And if they find three vessel disease, and if possible, they always open them up with bypass surgery, and the heart muscle can recover if it is not permanently damaged.
And Doctor, can we give such patients vaccination?
Severe form of heart failure, 22%. Suppose the patient may be in heart failure, so it depends on his clinical condition. He's already on a heavy dose of a lot of drugs to support his heart, and if he's not stable, then most centers may not give because of the immediate risk or any complications related to that.
Right. Doctor, thank you so very much for your time. You have really given a lot of explanation and information. A lot of people have taken the answers from you. I'm sure people would understand the severity of COVID-19 and its damage to the heart. And of course, we've got answers from you related to the COVID-19 vaccination on people who have chronic diseases like blood pressure. So thank you very much, Doctor. Doctor, before we end up the session, what would you give us? What would you would say? In fact, I would say related to a take-home message that we can do. And of course, as I mentioned earlier, it's a Mother's Day. So what do you have to say on this, Doctor?
Happy Mother's Day to all mothers and expectant mothers, first of all. And COVID-19, I think, is more to be prevented than gone through. So the question of dealing with it comes only if you are exposed to it. So as far as possible, uh, practice proper hygienic measures and proper wearing of mask and avoid crowding and come into contact with positive cases. And these are the general advice. And once you contract it, the only thing to look forward is to watch for symptoms, particularly palpitation, shortness of breath, and easy fatigability. And if doubtful, approach a doctor and do the necessary things.
Thank you so very much, Doctor. Before closing the session, I would request Dr. Jacob is currently practicing in Prime Medical Center, Jumeirah. You're always more than welcome to book an appointment with him if you want to at 047070999. You can see the number moving in the bottom of the screen, or you can book an appointment through our mobile application, which is available at Android and iOS, which is Prime Health Me, and book an appointment as per the schedule of the doctor. Moving forward, it is really important for us to take recommendation from you. Please give us a feedback with your reviews on Google Reviews and our Facebook page, that is Prime Health with a blue tick, and we'll be more than happy to receive your feedbacks for our better services and a better personalized care personally that we can provide to you. Thank you very much, everyone. We'll be coming back to you with another session. Till then, take care. Bye-bye.